I'm Gail Alston. I am the director of the RCI Training Center for Excellence. And again, I welcome you all to our webinar. I wanted to introduce to you our staff. In the upper left-hand corner, you'll see all of us standing in front of our new Rosalynn Carter Institute building at Georgia Southwestern State University campus in Americus, Georgia. In the lower right-hand corner, you'll see our training center team, Cindy Holloway on the left, and that's me on the right. I have promised today, that we will have a very brief presentation. I intend to keep that promise. Today we'll just be going over our 3 evidence-based caregiver support programs that we offer training, certification, and technical assistance for through our Center for Excellence. We're going to briefly go over them and just kind of explain what each one does, how it does it, and give you the information we think you might need to determine if it's a good fit for your organization. Why evidence-based caregiver support? Seems like that's what we're hearing everywhere we turn these days. Well, there are a couple of really good reasons for evidence-based caregiver supports. First of all is that they have proven in a clinical setting to reduce the despair and the depression that caregivers feel while they're carrying out their obligations as a caregiver, and increase the number of moments of joy that they have and the rewards they experience through their caregiving, which is, most of us are social workers. That touches our hearts. That's what we want to be doing out there in the field. It's good to know that these kind of outcomes have been proven rather than just something we kind of feel is what's going on. But a more practical reason why we're more interested in evidence-based caregiver support these days is that funders are beginning to require them. They are mandating that any programs that they fund will be evidence-based. And they do that for a very, very reasonable reason, in that the proven results are much more likely to bring around a valuable return on the investments they're making in these services to our family caregivers. So today we'll be talking about our 3 evidence-based caregiver support programs. First one is the BRI Care Consultation program, which is proven to be an alternative to traditional case management. Next, we'll discuss the RCI REACH program, which serves dementia caregivers. And finally, we will discuss the Operation Family Caregiver, which serves those caregivers of our returning military service men and women. The Rosalynn Carter Institute really enjoys or supports the public health approach to serving caregivers, which I'll put this chart up so you'll kind of see how these build on each other. We believe that there are universal caregiver supports that should be available to all caregivers from the very beginning of their caregiving journey. Next would come your selective programs. Those are more targeted. Those are for the caregivers that have a higher level of risk for burnout or burden, depression. And then the indicated level programs are for those that are even at a greater risk, that are in the danger zone for burnout and the poor health outcomes that are sometimes associated with caregiving. Then to plug in the name of some of those interventions that you may be familiar with, of course we have the BRI Care Consultation we'll be discussing today, but also traditional case management would be considered a universal level. Powerful tools, which many of you are familiar with, Savvy Caregiver, the COPE program, and all universal level programs. And then when you get into those more intense programs, we're talking about RCI REACH, ESP, New York University Caregiver Intervention, and the Operation Family Caregiver program that we will also be discussing later. Oftentimes people think of indicated level as being either extension of those selected levels or enhanced services added to the selected level interventions. When we look at the kind of outcomes that we can expect from the BRI Care Consultation program, you see that many of these directly affect the quality of life for our family caregivers in terms of depression, stress, and burnout, and meeting those needs that were identified as unmet prior to the intervention. The other 2 outcomes, hospital admissions and emergency department visits, certainly also impact the quality of life for caregivers. No caregiver likes spending time in the hospital emergency room. That also addresses that bottom line cost to our third-party payees such as insurance companies, Medicare, Medicaid. Very important outcomes. The protocol is a simple protocol, actually. It's a minimum of 10 calls held over a 12-month period. Now, that's a minimum. Those are the care consultant-initiated calls. It involves an assessment. I'm going to discuss that a little more thoroughly later. Action plans, and then our care consultation information system. Now, one of the really exciting things about BRI Care Consultation is they do a different kind of assessment. Anybody who's been in the field working with caregivers knows how burdensome that initial assessment can be, where you're just going through this list of questions, gathering this information. The assessment included in BRI Care Consultation is a triage model, which is to say that they use trigger questions. They don't do it all at once. As soon as the care consultant and the caregiver identify the first few things that they want, the challenges that are most pressing in that caregiver's life, they immediately move into action, developing those action plans, helping that caregiver resolve those issues. They have up to 4 months to go through the full list of trigger questions, and then through the remainder of 12 months to reassess those trigger questions. So that really takes some of the burden off both the care consultant and the caregiver in the initial moments. Care Consultation Information System is another critical piece for this intervention in that it is a computer-based access database that guides the care consultant. It kind of holds their hand through the process, makes sure that they don't drop anything or miss any information that they need to be gathering. It also serves to trigger and remind them of the steps that they should be doing, so that really they're following the protocol and that caregiver is getting the comprehensive service that they need. I wanted to give you just a snapshot of this, of the Care Consultation Information System. As you can see, it's got all the little bells and whistles. It's been tested in many different settings by many different types of care consultants, and they continue to tweak it so that it's as user-friendly as possible and pretty much fail-safe. I also wanted to tell you, I'm sorry I didn't share this with you earlier, that care consultation is a little different from other caregiver support programs in that you can work with just the care recipient, or you can work with the care recipient and the caregiver, or you can work with just the caregiver, depending on which member of that dyad is most available and interested in your service. That makes it an all-inclusive intervention. Now, in terms of, is this right for you? When you look at your staff, do you have the right staff for care consultation? The most critical piece of this is going to be the interpersonal skills, someone that's going to be able to exude the warmth and connection that you can by phone. They do not have to have clinical credentials. If you can afford nurses, that sort of thing, that's one thing, but many of our agencies do not have that level of staffing. So it's good to know that it can be delivered by people that do not reach those credentials. However, they have those skills, oral communication skills, but also they need to know those community resources, because that's a big piece. There is a part of the CCIS program that keeps up a database of both regional and national resources. So they have those prompts, but still being able to connect, this is right for you, is a critical piece for their service. The caseload can be 75 to 125 clients, and that can depend on how much of their time is allocated specifically to care consultation. And sometimes there may be some administrative assistance that's provided in terms of following up on some of the action plans by additional staff. So that's why there's such a wide range of 75 to 125. I think it's remarkable that the average time spent per client is 6.27 hours, considering the tremendous outcomes that we get from this intervention. And certainly the cost is extremely reasonable, $1.03 a day, or $376 per year. Now we're going to talk a little bit about a selected level caregiver support program, our RCI REACH program, which is for dementia caregivers. It's been proven to reduce the frustration caregivers have with types of problem behaviors often experienced by the care recipients. Also, pretty significant reduction in burden and depression, which of course are very important to caregivers being able to maintain the level of care and their own self-care so that they can hold on to their good health. RCI REACH is geared to the higher stress and burden experienced by dementia caregivers. Research shows that dementia caregivers do experience greater burden, depression, and worse health outcomes than the general caregiving population. RCI REACH is a very structured intervention. In fact, the sessions are scripted so that in the beginning, interventionists or care coaches will know exactly what's expected to be covered in each and every session. Of course, we know that they're not going to be reading that script as they deliver it, but that kind of guidance is critical to being sure that they're delivering the components of the intervention that has proven to effectively reach those outcomes. They address several different areas: safety, isolation. Certainly you can read this. The Caregiver Notebook is a wonderful tool that's used by the interventionist and the caregiver, and it's left with the caregiver following the intervention, and it lists strategies that address caregiver issues as well as care recipient issues. It really becomes a working manual for the caregiver during the intervention and afterwards. There are 12 sessions delivered over a 6-month period. First, they're going to provide education on dementia to the caregiver, and oftentimes caregivers, that's that light bulb moment for the caregivers when they finally understand that it's the disease, not just the willfulness of the person they're caring for, that's causing many of the frustrations that they experience. It's an empowerment model. That's why we're addressing the stress management, problem-solving management, all of those things, so that when the program is over, that caregiver is going to be much more equipped to deal with the ongoing issues of a progressive disease. There's some flexibility between in-home and telephone delivery, so agencies that are serving a greatly rural population may choose to have more by phone than by home. That is an individualized decision based on the needs of the caregivers and the agency. Now, again, the REACH care coach does not need a clinical background, but I would say the biggest thing they need is that understanding of the experience of dementia care and understanding what the caregiver is going through. That is critical to making the connection and being able to help them cope. They can carry a caseload of 22 caregiving families, depending on how rural, how much time they have to spend in travel. The average cost when we did our cost analysis proved to be $7 per day or $1,277.50 for the total intervention. Okay, Operation Family Caregiver. I'm sorry, I lost a slide somehow in the transfer. The slide that should have been there would be telling you that the outcomes from Operational Family Caregiver reduces caregiver depression very significantly and also increases the satisfaction of life for those caregivers. We know that so many young families find themselves coping with the post-traumatic stress syndrome and traumatic brain injuries of our returning military, and they are ill-equipped for dealing with that. Many of them are very young, and the problems that surround that can sometimes be overwhelming. So Operation Family Caregiver was designed specifically for that population. It provides the in-home support, also delivered by Skype, and all of these strategies for coping with troubling behaviors. It is a one-on-one, and it's very sensitive to the military culture. There are 4 in-home visits, although we have had a great deal of success with our RCI model in delivering it via Skype for our families that we're serving, and even by telephone. There's monthly telephone availability. The caregivers can access the interventionist when needed, and the program length is generally 4 to 6 months. The caregivers really are touched by the fact that the intervention is focused on them and delivered by someone who understands the military culture, and that is the critical piece when you're staffing this intervention. They can carry a caseload of 22 caregiving families, again, depending on what kind of service model you put in place. If it's all by Skype, you might be able to carry more than that, just depending on the amount of time devoted by that interventionist. I can't really tell you the average cost. We have not run that analysis at this point in time, although I would suspect it would be somewhat lower than the cost of RCI REACH because it's less length of time, and it's also fewer contacts and can be done more via the internet or by phone. So those are our 3 evidence-based caregiver support programs: BRI Care Consultation, which is our alternative to traditional case management; RCI REACH, Dementia Caregivers; and Operation Family Caregiver for our military service members. I want to let you know that the RCI Training Center for Excellence, we provide training and certification in those 3 programs. We believe it's very affordable, easy access. We can come to your site. You can come to our site. We can train agencies, or we also periodically hold classes for individuals to come to gain this certification for themselves. Technical assistance is provided some level via the contract for the training, at a more increased level, a little different package. And then for the agencies who contract with us to provide training to their staffing, we also address the issue of staff turnover. How many times have you had people trained in an intervention and then those people leave your agency and you have to go to the expense to have them train again or forget about that particular program? We will train your replacement staff over that first year of implementation based on the contract we enter into for that original training for the agencies. We will have more in-depth conversations about these 3 programs. The times and dates are on the screen, and we will be sending this information out to everyone who attended this webinar. Now then, we are to the point where we will gladly take questions. I think it's better if you could type your questions into the message box, and we will read them out and then answer them. Do we have any questions? Okay, I'm going to unmute just in case there are people who don't really want to type, or I'll unmute, but this is going to mute everybody.
The conference has been muted. The conference has been muted.
I hit the wrong
The conference has been unmuted.
Okay, does anybody out there have any burning questions for me? I see someone speaking, but I can't hear them. Okay, here comes a question. Have you had any luck contracting with medical institutions? No, we haven't done that yet, but we will be pursuing that through various venues. What is the cost of the training? Okay, I should have put that screen up there. They're varying costs. The RCI REACH, hold on one second for me. RCI REACH can be provided at your location for a cost of $5,000 plus the cost of traveling to your location. For that amount, we will train up to 10 people, certify 4, and then, of course, you would have training of any staff turnover in the first year. For the BRI Care Consultation, there's an $8,000 cost for that, whether at your location or ours. That is more expensive because that includes the installation and technical assistance for the computer program, the CCIS. Operation Family Caregiver is also $3,500 at our location, $5,000 at your location. Becky Duran wants to know, under BRI Care Consultation Information System, how easily can this software be integrated into other client database software programs? Is it compatible with other programs, and if so, which ones? I'm going to let Cindy Holloway address that.
Hello. Currently, BRI Care Consultation is being developed into a web-based program. It's being piloted right now in the state of Georgia as a cost-effective alternative to level 1 case management, and this is the goal is to work towards that web-based program so there could be an integration of systems. It should be available within the near future to where there would be an opportunity to cross over from the systems.
Okay. Any other questions? What we will be doing is we'll send out our pricing structure sheet, also the links to the additional webinars that are more in-depth for each of the programs. And we hope that we've at least tweaked your interest in our programs, because we are very proud of them. We think they make a big difference in the lives of caregivers, and look forward to working with your agencies in the future. Thank you very much.
Thank you. Please stand by.